Hello everybody, I am Dr. Jasmeet Aluwalia and I am a bariatric and a metabolic surgeon. In this video, we'd like to make you understand what is the normal process of food digestion in our body. It's very important to understand this, to understand the way different bariatric surgeries help to reduce weight. So a lot of patients have a lot of confusion in their mind that what are the types of surgeries, how they help, what are the differences, and which surgery is probably the best for them. So we'll explain the normal digestion of food in this video, and then in different videos we'll try to explain the different types of surgeries and their pros and cons. We ingest the food in our mouth and chew it. After chewing, it goes to a long pipe called food pipe or the esophagus, and from there it enters an organ called stomach. Stomach is the first storehouse of food in our body. The outlet of the stomach is controlled by a valve and it remains closed for a while so that the stomach crushes the food inside it, and we eat as much as the capacity of the stomach allows us to eat. Once the stomach is full, we feel that we had enough food and then we stop eating. So the amount of food that we eat is determined by the size of the stomach. The uppermost part of stomach is called fundus of the stomach, and this part secretes important hormones like ghrelin, which is the main hormone to cause hunger sensation in our mind. Once the food is properly churned by the stomach, it lets it go out and it enters the first part of the small intestine called duodenum. There it mixes with the juices from pancreas and liver, and that initiates the first digestion of food. So in the following part of intestine, the food starts getting absorbed in the form of proteins, carbohydrates and fats. The more the weight you have, the more is the requirement of your body for food, and the more food you eat, the bigger the size of the stomach becomes. So if somebody is weighing double than the weight than the person should have, will have to eat more to give support to most of his organs, and the stomach size will also be more, and you feel more hungry, you eat much more than is required for your body, and it becomes almost impossible to reduce weight because now the size of the stomach is much bigger, and the more you try to fast, the more you try to eat less, the more empty the stomach remains, and more is the hormone ghrelin secreted and more hunger you feel. So after a while the dieting becomes impossible. Because once you exceed the BMI of 37.5 for Asians or 40 for other population like Europeans, Americans, the capacity to lose weight without bariatric surgery becomes very less. Your chances are you may be one of the lucky 1% to 5% you can lose significant weight, and then again, even if you lose significant weight, it will come back very quickly. It comes back, and almost 99% of the people are not able to lose weight without bariatric surgery. So now that we have an understanding of normal digestion in our body, I think you will be able to understand different types of bariatric surgeries, how they work, and maybe you can figure a way out which one is the best for you. Thank you.